Good evening, everyone. I am Varsha Shrivastava from Bladder Wellness. I hope you all are keeping safe. Please vaccinate yourself and wear a mask when in a public place. Today, we are here to talk about overactive bladder or urinary incontinence. Overactive bladder is a frequent or sudden urge to pass urine that may be difficult to control. The condition is common and distressing and may have a huge impact on the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what is right for diagnosis and treatment of urinary incontinence, today we have with us Dr. Prabir Basu sir. It gives me an immense pleasure to introduce Dr. Prabir Basu sir to you all. Dr. Prabir Basu is a senior consultant urologist from Kolkata. Sir has a rich experience of over 18 years in the field of urology and carries out the treatment with utmost precision and efficiency, ensuring that the patient's health are in safe hands. Sir, it's a pleasure to have you in our show. We welcome you, sir.
Good evening. Good evening.
Sir,
Hello,
there are many
everyone.
things we would like to know. First, we'll start with what is urinary incontinence?
Well, Pasha, I think the first thing we have to say is we have some time or the other had faced this issue that suppose we are going outside and coming back home, and while we are opening our door or whatever, opening the locks or whatever, we get this sudden urge to urinate. Okay, and something happens, and something happens before we open the door. We have severe pain in our lower belly. Some of us leak, and all this thing happens. This is how patients, actually people, tend to understand that they are suffering from what is known as a urinary incontinence. Because prior to that, they do have the symptoms of urinary incontinence. What is urinary incontinence in brief? I will want to tell you. It consists of, one is the severe impulse to pass urine. That's the most important thing. Say, suppose I'm the patient, I'm sitting in front of you, talking to you in front of a large live audience. All of you are there, and all of a sudden, I feel that I have an urge to urinate. I have to go to pee in my restroom. But what will happen to me? What will I feel? That we will also feel, okay, Dr. Basu just introduced himself and now he's going to pee. So I will tend to control the urination. And what will happen with time is that I will have a discomfort in my lower belly. So sometime I will be able to suppress this impulse, but later I will tell you, Vash, I need to go. Okay, thank you, please. I need to switch off this microphone and the video, and I have to go back. I need to go to pee. This is what is known as incontinence. So basically, if we talk about what is incontinence, I would like to say that there is what is known as the urge incontinence. That is the story I told you. Let me tell in this section with all of you around. Let me don't go. Let I don't want to go into total medical jargons. I want to tell you stories so you get to understand what is the symptom and must be aware of what you're suffering from, because the purpose of all these live sessions is to make you aware. Because no, it's like when you drive a car. Suppose you don't have your normal person who normally drives your car, who's coming because of this lockdown, and you're starting a car after quite some time, maybe 5 to 10 days, and you see some abnormal flashlights blinking in your dashboard, and you don't know what's happening. Okay, you don't know what's happening. That is the time when you call up your mechanic and ask him, so this is one yellow light which is flashing on my dashboard. What is the implication of that? So the first thing is that you have to understand that you have some problem. You have some problem. Then you can ask the specialist, what is the problem I'm suffering from? So as I said, the story I told you of myself going outside, coming back home, unable to open the lock of my main door, front door, or I'm sitting in front of you, suddenly I'm feeling this urge to pass urine, is what is known as the urge incontinence. This is known as the urgency and the urge incontinence. This is different, very different from a person. Suppose our grandmother, she what it does, we are Bengalis actually. When we have this tradition of doing pujas in the evening, and we blow conch shells, the conch shells, those that we blow. Whenever she tries to blow a conch shell, she leaks. And she says, I can't do the pujas every evening because it's becoming very cumbersome for me. It's very embarrassing for me with people all around. And when I blow a conch shell, I somehow there's a leak of urine. This is
Hmm.
what is known as a stress urinary incontinence. And this is very common in elderly females.
Okay.
These are also common in male patients who have prostate issues. We'll come to details even whenever as we go along. So
Hmm.
mainly we are thinking about
Hmm.
the urge incontinence, the
Hmm.
stress incontinence, and there is a post-operative term.
Hmm.
Some persons, we know that in male individuals, we have two sphincters. Okay, we have
Hmm.
two sphincters, urinary sphincters. Now that I'm in front of you, I'm talking to you live.
Hmm.
I have this urge to urinate, but somehow I can't go. I'm compressing with my two sphincters. So we have an internal sphincter and we have an external sphincter.
Hmm. Hmm.
Now, internal sphincter, we both internal external, we don't have any voluntary action. The internal sphincter is what is known as the prostate to common layman. So it's called a prostatic sphincter.
Hmm.
And external sphincter is what is known as a rhabdosphincter. Okay, it's a skeletal muscle sphincter. Now, what really happens is after a person undergoes an operation called a prostatectomy, so it can be a TURP, which we know laser, open surgery. So his internal sphincter is being chopped off. But I'm telling this in a very layman term. We have resected out the internal sphincter along with his prostate. So what we have is the external sphincter. And by if any problem, suppose my neurologic issues or by some other problems, I have a deficient external sphincter, then I will go into leak urine after whenever I have my bladder full. This is known as the post-surgical incontinence. So basically, clinical wise, you can ask me, there are two types of incontinence. What is the urgency and what is the stress incontinence or a combination of it?
Yes. Okay, so the meaning, the type is clear to all of us that what is actually urinary incontinence is. Okay, and sir, who are more prone to this disease? Elderly patients only, or even children can have it?
Yeah, yeah, children. I will come age-wise, okay, age-wise. I have my nephew, who is just about 4 years old. 4 years old. The problem with him is he just binges on all this chips and all these things, all this fast food, junk food. All these young kids are all binging on this thing and watching Shinchan movies and doing nothing else. And all these exams. So dar to mid gaya all among all children because of this lockdown. Now, what happens is because he's leading all this, depending on all this junk food, his toilet training has gone totally out of the roof. He's not passing stools in a normal way. So he's constipated for 1 day, 2 days. Then he gets a spanking from his mother, and then he goes off to shit. So ultimately, what happens is that because of this poor toilet training habit, he also has urgency symptoms. What he says to his mother, then mummy, my pants are wet. So mummy says, go to the toilet and relieve yourself. He goes to the toilet, relieve himself, changes his pants, and then comes back, watches a Shinchan movie, and after half an hour, she says, Mummy, I'm wet. Same thing happens. It's very common. Young children, 4 years, 3 years, 5 years, they go to pass the urine, they pass urine in spurts only, they come back, and then they have another wetting.
Yeah.
So as I was saying is that there are two types of it's nothing to do mostly with the obstruction in his urinary tract. It's mostly because his bladder has become overactive.
Hmm.
So the bladder becomes sort of irritable, just like a person becomes irritable. It's when
Hmm.
he's stressed out. When the bladder is stressed out because of constipation, because of poor toilet training habits,
Hmm.
and gets stressed out and goes into multiple sort of contractions. The contractions are not to that severe extent that he will be able to pass the urine totally. So when he does an ultrasound, he may be showing some amount of residual urine in the bladder.
Hmm.
So these young kids suffer from urgency and urge incontinence due to poor toilet training habits. This comes with the young kids. Okay.
Okay.
Now, there may be kids having neurological symptoms. These are basically pathological cases. I'm not talking on this on as such. Next issue is the same thing in young females. I've seen young females. They have this I mean, you can say poor habit of suppressing their urination for quite some time because it happens also with my sister. And when the lockdown was, there was no lockdown, there was no COVID situation. She used to travel, go to the college, and somehow she was too finicky with the restrooms in our college. Okay, the college premises. She used to say, no, 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 no. I will pee and go out. I will not pee in the रास्ते में तो हम नहीं करेंगे और college का काफी गंदा है. I will not pee over there. I will come back and then I will pee. Now I will tell you, this is very common in our young women folk. Okay, all these ladies who goes on, who do regular work, who are on a normal job, 9 to 5, young ladies going to the college, that they tend to suppress their urination for quite some time. Okay, so initially this is not a problem, but later on, this leads, what I said, leads to irritability of the bladder wall. It becomes an overactive bladder. Overactive bladder is basically consists of these things. Urgency. Urgency means she needs to go to the toilet suddenly. Frequency is that she needs to go to the toilet every other, maybe half an hour. So we have patients coming to us saying that I need to go to the toilet 50 times a day. Oh my God. You may be thinking, now he may be joking with me, but no, it's true. People need to go to toilet as frequently as 10 times in 1 hour. What does it mean? What does it imply? He doesn't need to do any work. He just sits in the toilet. So his lifestyle is totally, I mean, gone out of the roof. So urgency, frequency, which urge incontinence? That is overactive bladder. Urge incontinence is basically the leak associated with the urgency. So overactive bladder, as I said, is of two types. Roughly, for a layman point of view, it's a wet type and a dry type. What's a dry OAB? Now, these were the previous definition we normally went through in our medical school times. It having changed, but for the simplicity of our discussion, dry OAB is the situation a young lady feels in the early part when she is suppressing her urination for quite some time. What happens now? Now that she is having the urge to urinate, now she is having pain. This is known as the bladder pain syndrome. First of all, she had this impulse, she had the sensation that the bladder is getting filled, but somehow she had this willpower to suppress her urination. But with time, what happens? Now that it becomes a OAB, dry type, the nerve gets irritated, the is getting upgraded, or they can say the painful nerves are getting more activated. Now she will have a pain in her lower belly. Now she has to go, or else the pain will become severe. There are multiple differential diagnoses to this bladder pain syndrome. I'm just telling you the story about. But the most common thing in a young lady has suppressed her urination because she has to go to a 9 to 5 job, or she has to go to a college for quite some time. After this, what happens is she goes to a state of a wet OAB. What is a wet OAB? Is that now she had the sensation, she had the impulse, she had that willpower, she had this pain in her lower belly. Now what happens? She leaks. That becomes a very embarrassing situation. Now she's having urgency with an urge incontinence. So that is one type of incontinence affecting the young female population. Now I will come to two group of patients. One is elderly males and the other elderly females. Okay, this is the rule of the thumb. I'm not talking about neurological impaired patients, not I'm talking about spinal cord injured patients, road traffic accidents. These are special situations. Okay, this must be dealt with in a more specialized, we can say a more specialized people with more neurologists all around. But day in, day out, we have these people suffering. We are seeing them in front of us. One is an elderly female. What happens to the elderly female is, whenever female ages after menopause, there is loss of local estrogen in her genital areas, in the private parts. What happens is, estrogen is a hormone which keeps her local private part healthy, soft, and supple. So if the estrogen goes down, what will happen? She will have vaginal dryness. All these issues of vaginal dryness, irritation. She will say she doesn't know where the pain is emitting from. Maybe from a menstrual area, maybe from a urethral area. Two is that she will have a rigid urethra, which is not coacting well. What does it mean? I'll tell you what. Normally, females have a 4 centimeter long urethral tube. vis-a-vis a male who have a 20 centimeter urethra, that is our urinary pipe, that is within our genitalia, that's only within the penis, but the females are very short urethra. Because I suppose take for me, I mean, I'm a female, I am coughing, the bladder, the pressure being generated within bladder doesn't go out within this 4 centimeter small tube outside, because the urethra is pliable, that's it's flexible, and it's also properly coaptable, that is, it closes off, it seals. Whenever there's a pressure building up within the bladder of the female, the urethra seals easily. All the tissues, muscles, and everything in the small 4 centimeter area dependent upon estrogen. So whenever we have a postmenopausal woman, 45, 50, 55, 60, as she ages, estrogen level drops, and the whole urethra, the pipe function, which was pliable at first, which was coaptable at first, becomes rigid and doesn't coapt. So whenever I cough, whenever my grandmother, I told you the story, grandmother blowing a conch shell, doing this evening pujas, whenever she blows, this is known as the Valsalva maneuver. There's a lot of abdominal pressure, it presses upon the bladder. Whatever urine, she may not have a full bladder, but whatever urine, it leaks out through that small 4 centimeter pipe.
Yes.
This is known as a stress urinary incontinence. Very common in elderly females. Okay, they will tell you, they will come, they have taken a lot of medicines. They will tell you, I saw Dr. A, I saw Dr.Prabir Basu, I saw Dr. C. They gave me medicines, but nothing helped me. Nothing helped me save me, because I'm getting ostracized. Okay, my husband is telling, what are you doing, dear? You're always leaking urine all around. What can I do? I have to put on my all this the male the diapers, and when I go around, I'm totally frustrated. This is one issue. Same thing happens if a female has an early surgical menopause, that is a young 30-year-old female, some issues, some endometriosis, whatever, some gynecological issues, undergoes total abdominal hysterectomy, or whatever, hysterectomy with with the removal of the tubes in the ovaries. So she has an early surgical menopause. So with time, even when she's 35, 38, 40 years, her estrogen level has dipped to any postmenopausal woman. She will have the same symptoms. So stress incontinence can happen to females mostly whom are postmenopausal. The other category I want to tell you is male individuals with a prostatic symptoms. Very common today. Prostates has been in male individuals in the time of Adam and Eve. Everybody knows prostate has been a part of us.
Yes.
But as we are aging, as our life expectancy is increasing, then we are living longer, and the prostatic symptoms, because suppose 200, 300 years ago, the life expectancy of normal Indian was may not be more than 55 years. Okay. So maybe the prostatic symptoms started at 5 years, and they used to die before they had any other problems.
Yes.
So as are we aging graciously, normally, healthily till 90 years, that's okay with all of us. They are having these prostate issues. What does a prostate do? What does a prostate? Prostate is like a ball valve. Okay, it's like a ball valve. Suppose we have a wash basin, and there is that area now where the water goes out, the outlet, and you put a coin inside that area. Okay, it's like a sieve function. The coin stops the outlet, and you have the wash basin flowing with all this water. Same thing happens. The prostate obstructs the bladder, and lot of urine becomes stagnant within the bladder. Whatever happens, because of the stagnant urine, the bladder becomes irritable.
Yes.
So now, because of the prostate is primary, the bladder becomes a secondary. Because of our prostate issues, the person is having irritative LUTS.
Yes.
LUTS is a term. We are not using the term in the normal medical terminology that we use. We don't use the term prostatism. We use the term lower urinary tract dysfunction, or the lower urinary tract symptoms. That's a LUTS. LUTS means it is prostatic symptoms, but it doesn't not mean it's only caused by the prostate, the obstruction part. It also includes the secondary effect on the bladder with irritative, like urgency. That's the story I told you. I need to go to the toilet. I have to rush to the toilet.
Yes.
2, frequency, every now and then. I've come back, then I come back and then go back again. Nocturia. Nocturia is what is thing? Nocturia, I will tell you one thing is that I go to sleep, I fall asleep, I get up with the urge to urinate, I go to the toilet, pass the urine, come back, sleep, again I need to get up with the urge of urination. more than one times in the night throughout our sleep. All this becomes under what is known as the irritative lats due to bladder overactivity secondary to prostate obstruction.
So there are many problems that we have to go through because of urinary incontinence. So what is the treatment for it? Is there any medication provided, or we'll have to go for the surgery only?
No, 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 no. That is, I mean, Vasha, that is a big issue that we are having because
Mhm.
I see a lot of my patients actually. I also I have a Facebook group, Facebook community where I have people from different places actually, from far away from Africa, from Europe, from USA, they all interact with it. We all interact because I mainly deal with male health issues. So I believe that we males need to have a peer group. Okay, for because we can't say that I leak urine and I can't tell this to my wife. I can't tell this to my parents. I can tell this to my office colleagues. They will laugh at me. Okay, so we
Yes.
need a area. We need a community to discuss among because we are all together. I mean, all
Yes.
like-minded people. So what I feel from that community, because we are always interacting, what I see from my members is that people are a bit, you can say, misinformed. That whenever we go to a doctor, he will give us some costly medicines. He will give us some medicines which will go for a long time. Because I have these questions for many people that doctor साहब आपने तो मेरे को medicine दिया, I'm having this prostate issues. Do I need to take it for all of my life?
Yes.
The rest of my life I depend on my medicines. और ओके डॉक्टर साहब हमने आपके पास गए थे, डॉक्टर ए ने बोले, डॉक्टर बी ने बोले कि कट माय प्रोस्टेट. I because of this I don't want to go to the doctor.
Mhm.
The discussion today evening I started is the story of me myself starting my the ignition key of my car after 10 days of lockdown where my driver hasn't come.
Mhm.
What I see, I just go back to the story again because I'm going to hammer a few points to the audience today. The
Mhm.
audience today, August audience today, is that it's important. You need to know that you're suffering from a problem.
Mhm.
Okay, the awareness of a problem is the primary indication that you must have this in your mind and take a proper expert opinion for that.
Yes. That's the proper treatment. Mhm.
That's a proper treatment because ultimately you will be cured. Ultimately you will be cured of your disease.
Mhm.
But if you tend, because नहीं हम तो नहीं जाने वाले वहां पे, हम तो वो डॉक्टर साहब बोलेंगे तब दवाई ले लो for years and years together, or that doctor साहब बोलेंगे हमको prostate काट देंगे, हम तो I don't want to get myself operated under the
Mhm.
knife. The problem happens is you go on having this issue for quite some time, and ultimately that barrier between a cure and the cure goes off. Now the doctor has to control your disease.
Mhm.
So the point of cure has been lost, and now the specialist will control your disease. So ultimately, what will happen if you are not compliant to the treatment protocol? Then you will
Mhm.
have recurrence of the symptom. That is very common in
Yes.
people suffering from bladder overactivity or this incontinence issues.
Yes.
What is the main problem? They will say, I've gone to a doctor. He gave me 1 month of medicine. I was fine after 1 month. Why will I buy medicines again? I stopped
Yes.
it for 15 days. I was fine. The next 15 days, I had recurrence of symptoms. Then he
Yes.
comes to me, Dr. Saab, Dr. Prabir Basu, you gave me this medicine. I was well, but after I stopped the medicine, I started leaking again. So
Yes.
what does it mean? It happens in young children. The example I quoted of my nephew, I
Mhm.
put him on a tablet, whatever, oxybutynin is a very common for young children.
Okay.
He got it for 5 milligram for 1 to 2 months. He was fantastic. Okay, he's a very good. But what he did, he didn't give emphasis on his shitting habits. He was still
Mhm.
constipated. His
Mhm.
mother said, "Okay, he's fine. He's not wetting his pants. Yeah, let him be like that. Binge on this Coca-Cola and all these bingos and Shinchan movies. Let him do. Let him be like that." What happened? He stopped all the medicine after some because 2 months. Who wants his kid to go on medicines forever? But
Mhm.
because we didn't control his primary problem, he had recurrence of symptoms after he stopped the medicines for 1 month.
Okay.
So that's what I want to say.
Mhm.
The problem is try to understand that I'm suffering from this disease at the very early instance.
Mhm.
and take a specialist help.
Yes.
Then what happens? You don't need to depend on your medicines per se. Don't need to go for surgeries at the outright. I mean, the doctor says no, you have to go for surgery right away. You depend upon lifestyle modifications.
Okay.
Okay.
Hmm.
So simple lifestyle modification. We'll come to this. Simple lifestyle modification can keep you bladder healthy. If you are diagnosed at the primary stage.
Okay.
So, Masha, the next question will be what are the lifestyle modifications, isn't it?
Yes, the treatment answer we have got that through medication and through surgery, we can cure it really. But when we talk about the lifestyle modification, then what we can do, please elaborate on
Yes,
that.
yes. So take your. I mean, I want to tell what might be causing overactive bladder.
There's a
Mm,
question.
yes, yes, yes. I think he's from Muhammad Shukhawat. No?
Mohammed Shahrukh has put up this
Muhammad
question.
Shahrukh. Muhammad Shahrukh.
Yes.
Okay.
Hmm.
Mr. Shahrukh, the problem of the question was. Okay,
What
there are a
might
lot
be
of questions
causing?
coming. There's a lot of questions coming. We'll take the questions. The better we will take the question at the end. So I will be
Okay.
confused in my flow. Okay.
Hmm.
So well, Mr. Shah, just hold on. We'll take you all your questions at the later part of our program. So what I was just intending to say, because it will keep a block to my flow and everything will go out of my mind and maybe
No, it's completely fine. So, what are the
we have to
lifestyle
reboot.
modifications we
We
need
have
to
to
do?
reboot again and then again start. So the fact
Yeah.
is, this what is this lifestyle modifications? Okay. Now the problem is there are a lot of issues which happens with our bladder. Now there is what is known. I'll tell you very frankly, it's a story like thing. Let me be simple with you. There is a lot of lining within the bladder wall. Okay, we are having this young females, middle-aged females. We'll have a lot of them. Lot of them. You will see that they have what is known as the bladder pain syndrome. That is when she has this impulse. I told you the story of a young female who has this willpower, who has a willpower to control her urination to some extent, and then everything goes awry. So now she has a pain in her lower belly whenever she has this bladder becomes full,
Yes.
and whenever she urinates, she becomes relieved.
Yes.
That is known as the bladder pain syndrome. In the Western literature, we will find this disease is interstitial cystitis. In India, we are not aware of what is interstitial cystitis because we believe interstitial cystitis is a disease of the white men and female population, but no way it can happen to Indians. It's the only problem we are not aware of the problem. So the
Yes.
problem over here, what happens is interstitial cystitis bladder pain syndrome is, this is very common. I tell you, 5 out of 10 female individuals, I write it down, take it from me, guaranteed will suffer from this problem in some part of her life or the other. And she knows how to, she goes to a gynecologist, she gets some antibiotics over the counter, nothing happens. She goes to get some cranberry juices, nothing happens. And she says, Mera ko to aise hi hai, karna hai. I mean, I'm destined to have to live with my bladder pain problem. No, the problem what happens is there's a lining in the bladder. Every bladder has an inner lining. Every
Yes.
structure in our body is an inner lining. That's called the epithelial lining. We have some proteins, specialized proteins called the glycosaminoglycans, which protect the inner lining. It's some sort of icing on the cake, you can say. With time, with inflammation, we can say with infection, something or the other, this gag layer gets disrupted.
Yes.
Now, as we are binging upon all these things, now all these things on this everything white. You know what is white food, the proper American diet. Americans don't. They're well. They're intelligent enough, and they're not taking the normal American diet, which we used to. I mean, here in the 2010 and 2015s, that is everything white. These white people used to take everything white, white sugar, white flour, white rice, and whatever white. Now we are binging on this white sugar, white flour, white all this thing white, and all this form of trans fat, all this form of trans fat. So whatever this happens, all these toxins, simple thing, all these toxins which we take in our body ultimately gets filtered from our kidneys because our kidneys are being built for this. They're built for to take out the toxins from our blood. and to give it to the outside, excrete outside, and while it's excreted, goes to a space called the urinary bladder.
Yes.
Now, what happens? A lot of toxins and solute materials which are harmful to the bladder wall or bladder muscle, whatever, the bladder as a whole. So whenever there's a loss in the icing on the cakes become absorbing all these toxins.
Yes.
So what really happens is within the cake, within the bladder wall, there are nerves. As I said, there are nerves. There are painful receptors. We have pain receptors everywhere. They can be itching, but when we cut, we have a pain.
Yes.
So these pain receptors will get upgraded because of the continuous invasion of these toxins within the bladder wall. So these patients will have severe pain when there is a lot of urine within the urinary bladder. But once this urinary bladder empties, she pees urine, the pain goes off.
Yes.
So the primary thing is to regenerate the ganglia. It will take time. There are medicines for it, but the first instance is you must not let toxins get in your body, so it goes into the bladder and being stored for some time. So the ganglia or the icing on the cake will take some time to regenerate.
Yes.
Okay, so avoid any spicy food, avoid any all these white things, avoid trans fat. All this creates toxins in our body.
Yes.
So as I said, simple lifestyle measures. If somebody avoids smoking, if somebody avoids alcohol, somebody avoids hot spicy foods, then all these toxins will not be generated in the blood.
So all these things we need to keep in our mind.
So yes, that's one thing. Second is as I said, constipation. Now the patients will come to me and he says that, oh, I'm come to you for a urinary issues while you're talking about this constipation, everything. No, these are all interrelated. Okay, the rectum loaded with hard stools will compress upon the bladder and will irritate the bladder. Okay, and will irritate the bladder. So ultimately, he will have to avoid constipation by taking proper fiber in his diet. So a lot of fiber and less of animal protein, red meat, and will actually a lot of plant-based fibers will help him control these urinary issues.
Yes.
Third and very important thing is all these things, bladder pain syndrome, interstitial cystitis, overactive bladder. In males, we have this problem of chronic prostatitis. Okay, young males, 25, 28, 35, sexually active, they have pain during having sex. Very common. They can't go anywhere because they're always frustrated. They don't know where to go, to whom they will need to take help from, professional help from. Chronic prostatitis, all these features, they have an element of what is known as a fibromyalgia. This is a disease process where we have migrainous headache, cervical pain, body aches, okay, pain in my hands, pain in my back, which goes down the legs, all these issues, they are basically treated by a lot of you can say meditation and anti-stress maneuvers, because these are basically type A individuals, always stressed out. All of us are stressed out. Actually, we have all these elements within us. So some form of anti-stress maneuvers, some form of meditation, some form of physiotherapy, some form of relaxation exercises always helps. And fourth, before I end this this thing on this lifestyle measures, is the pelvic muscle floor training. That is the most important. If somebody wants to go out from this YouTube live with only one thing in his mind, if he's suffering from overactive bladder, remember, you have this symptom, you have diagnosed it in yourself, and go for pelvic muscle training. I mean, this pelvic muscle training will help you a lot if you are taking this in your early part of your disease. If the disease progresses, then it's not going to be of function.
So there are many things that we have to keep in our mind and many lifestyle changes we need to bring upon that will really help us in order to save ourselves from urinary incontinence. So, sir, we'll have to keep the time in mind. So the questions, whichever the viewers are asking, it's humble request. So all the questions will be duly answered later on. Sir, my question to you is, what are the other things you would like to suggest to all our viewers that will really help us? And what are the things that you would like to suggest regarding urinary incontinence?
Yeah. So this is a very important question. I think it's I will the last topic we're going to discuss is the pelvic muscle floor training. Okay, medicines. We know medicines. A lot of good medicines in our
Yes.
armamentarium, and the most important medicines are Mira background. I
Mm,
mean, it has done wonders because most of these medicines we used to take previously. What happened was that what really happened is it's all, as you can understand from our discussion, it's the
mm,
bladder getting irritated. Okay, it's the bladder getting irritated, and if you want to soothe the bladder, what will happen? The bladder will become calm.
mm,
Now this has two implications.
mm,
Now, because my bladder was irritable, I had this sensation of going to the toilet often now and then to pee,
mm,
or
mm,
I have this pain in sensational lower belly. That has gone with some medicine I took to calm my bladder.
mm,
Okay, I'm telling this without going into details into pharmacology. Let me not go into detail about this medical jargons. Now, what will happen? Suppose this is an elderly individual, as I said, a male individual with a prostate. So there is some constriction in this outlet.
mm,
Obviously, the bladder has an outlet. So bladder, what will bladder do? Bladder will contract and push the urine outside,
mm,
excrete the urine outside to the outer environment.
mm,
A person with the prostate issues with some form of obstruction. Now,
mm,
what he used to do? He will have his willpower within the bladder. It's called the bladder contractility to
yes.
contract the urine and squeeze it out past that obstructing prostate. Now
Yes.
that you have calmed the bladder, what
Mm,
will happen is that now the bladder is not able to generate
mm,
enough force to squeeze whatever urine is there past
mm,
the obstructing prostate. That is what patients developed urinary retention whenever we gave him medicines for this overactive bladder or medicines for this urgency incontinence.
mm, mm,
What has mirabegron been a game changer for the last few years in our Indian context is that it works in a different pathway,
mm,
different from all the receptor wise from the medicine we used to have for the bladder irritability. So that a person is suffering from bladder contractility issues, he
mm,
gets the medicine, the irritative contractility is being calmed down, but the
mm.
normal contraction of the bladder to squeeze out the urine past the obstruction is retained.
Yes.
So ultimately, he is having calmness of his bladder, that is control of his incontinence, plus he's not having any obstructive issues or urinary retention. That
Yes.
is what happened in this with this Bina background. So
Mm,
the purpose of this is this is the wonder drug or wonder kit in the pharmacology of overactive bladder and incontinence, urinary incontinence, that
mm,
we must just give you a brief glimpse of it. So this
yes.
is one. Second is, as I was telling you, is the pelvic muscle floor training. Is the
Mm,
pelvic muscle floor training we are talking
mm,
about. Pelvic
yes.
muscle floor training is whenever this is very important. This depends upon our willpower.
Mm,
You may feel that what is the urologist saying all this BS stuff? She is talking about meditation and everything. A urologist is supposed to operate on prostate. Is talking about meditation. No, no, no. I'm not
mm,
talking about this meditation. What I want to say is early part, whenever you have a irritable bladder, this has been proved urodynamically by scientific basis. So if a person has an overactive detrusor contraction, detrusor is a bladder muscle to begin. So if he has an abnormal contraction of the bladder muscle,
mm,
if you can control it, you don't go to toilet,
mm,
then what would happen is that the contraction will die down,
mm,
and with some form of biofeedback, the bladder, you say that some people say the bladder is also brains. The bladder will understand now this guy who I'm a part of it will not let me allow to go to irritation every now and then. Okay, suppose I have an irritative wife and I always keep calm and cool. My wife will after some time will say, no, 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 this guy is not allowing me to get myself irritated. So I need to calm down and do what I'm supposed to do. So same thing happens with the bladder. What happens in pelvic muscle floor training? Whenever I ask my patients, whenever he or she has this, because they tend to know now I'm going to have this urgency. Okay, they will have this intuition within them. Now I'm going to have a leak.
mm,
Okay, so there are elderly females who tell you that okay, I'm fine, but when I go to the toilet, before two steps prior to entering the toilet, I leak. They know
mm,
everything. They know everything what will happen in the future.
yes.
Whenever I am having this impulse, I will sit down. I will sit down and take proper, I will sit down with, but like the way I'm sitting, with my spine up, okay, and try to contract my rectal sphincter. Now I don't have any voluntary control over my urinary sphincter. I have voluntary control over my rectal sphincter. That is what I need to. I have a full bloated belly. I need to pass gas. I cannot do so, but I need to contract my sphincter for that. So whenever I'm activating my rectal sphincter by biofeedback loops, my urinary sphincters are also getting activated. There is what is known as the Kegel's exercise for a stress incontinence. There is what is known as the biofeedback for urinary urge incontinence. Now you have to be very, these are two different issues. People get often confused about these two.
Yes. Okay.
What is stress incontinence? I told you, this is what I said is that the external sphincter is weak.
Yes.
Or the urethra is not rigid. In females, basically what our urethra is our external sphincter. So it's very weak, it's rigid, it's not working up to the mark. So we have to increase is power. It's like going to the gym and just exercising my biceps to increase the power. But I don't have any that, like the way I hold my dumbbell and just do this flexing, that my bicep increases. But I can't do this with my urinary sphincter. So I will depend upon my rectal sphincter to help me in the biofeedback loop. So what here I will do, I will contract my rectal sphincter, hold it for some time, and then relax with a proper integrated with my proper relaxation exercises.
Okay.
For a stress incontinence, what it helps is that with proper contraction, hold and relaxation, the urinary sphincter will also go into corresponding state. So ultimately, this leads to a proper strengthening of the urinary sphincter. This is Kegel's exercises for stress urinary incontinence. You do it for 5 minutes, 5 times a day, fine. You will, in the long term, you will have a person with a stress urinary incontinence, like my grandmother who is blowing conch shells in the evening during the pujas, will have benefit. What happens in an overactive bladder due to having urgency and urge incontinence? Okay, these patients will have this suppose an isolated bladder contractility, which will cause him some pain, which may cause him some leak.
Yes.
So if I am able to understand that I am having this contractility, which is increasing in severity, like that happens in a urodynamic study, I can understand this. What I do is that I sit and I go on contracting my rectal sphincter without any relaxation. This exercise, biofeedback exercise or pelvic muscle training, is different from an urge incontinence patient vis-a-vis a stress incontinence patient. Ultimately, when you're contracting your rectal sphincter, what happens is the contraction in the bladder goes off.
Yes.
Okay, it goes off. But for some time, the bladder will feel, okay, I'm being fooled by master, but I'm going to fool him again. Okay, then again he has this problem again. Then again I sit. Then again I have the willpower that I am the master, not my bladder is the master, and I control the urge. With time, they say, in fact, it's also Kegel who had introduced this concept. With time, what will happen? The bladder contractility, if it is not severe enough, then will go off. So whenever you have this early part of your problem, if you have this issue, if you have this thing, then try it in your home, try it in your office. Don't go to the toilet. Let it go off, then rest for some time, take your deep breaths, and then go to the toilet and to relieve yourself. So don't let the bladder take control of you, take control of your bladder. So this is the essence of a biofeedback exercises or pelvic muscle training in case of an urge incontinence.
Yes, sir. So many advices we have got and many important points also we have got over here. This session was really, really informative, sir. And this is for all our viewers. If you want more information about overactive bladder or urinary incontinence, then obviously you can reach out to Dr. Prabir Basu, sir. He will surely guide you in a very better way. Thank you so much, sir.
If you can allow me, I will just share my screen. If you just allow me.
Okay. Yes, sir.
So
yes.
This is my website. So I will request all my audience to go to the website. It's drprabirbasu.com. So you can come down. This website. You can see a lot of courses over here. So I've built these courses for the general. Some are in Bengali, some are in English. So you can go through the courses. Some are free, some are paid. I can understand, but I can tell you one thing: there are not many doctors teaching medical awareness programs online. Okay, so this is basically my mission or vision. You can say this. I'm not beating my drums, of course, but that's my mission, to empower a common man and a common woman to think about what he or she is suffering from. before she knows that. What happens is that we normal individuals don't know that we are suffering from a problem. Only when we feel we are suffering from a problem, the disease has gone to a much more extent.
Yes.
So the early part, if we know, if we are aware that this can happen to us, and this is the way Dr. Prabir was told to do these exercises and do this modification, dietary modification, and control constipation issues being taken off by a normal husk, these things, then we can control our disease. Okay, then obviously we are always there to help you with our expert advice.
Yes, sure, sir. Sure. We'll keep all these things in our mind. And this is for all our viewers. Please do visit the website and go through all the courses, and you will get the proper guidance for sure. And you can always reach out to Dr. Prabir Basu sir through his website. And if there is any question, you can surely ask, sir. Thank you so much, sir, once again for such an informative session. And thank you so much to all our viewers. We'll see you all soon. Please take good care of yourself. Thank you, sir. Thank you.
Thank you. Bye-bye.
Bye. Thank you, sir.
वर्षा वो स्क्रीन चेंज करो और स्क्रिप्ट भी नहीं भेजी थी ना, वो ब्लू वाला जो स्क्रीन भेजा है व्हाट्सएप पे।